One of the things, unfortunately, that I think has happened in our culture oftentimes is that we have an expectation that we should be happy all the time and that that's kind of the normative life experience. That has been made worse by things like social media, where we can compare ourselves to other people and think, oh, that person's always having such a great time and I'm just not. But it really is normative in life to have ups and downs. And so when we draw that line in terms of diagnosing someone or having someone seek treatment is usually when it starts interfering with their life in a meaningful way. And that could be socially, that could be with their occupation, or it could just be functionally, like are they able to shower and do appropriate hygiene at home? There are several different types, and generally when people refer to depression or you hear the term thrown around a lot, that person's depressed or I'm feeling depressed, there is a specific list of criteria that we use to describe depression. And the most common subtype of depression that you'll hear about is what's called major depressive disorder. So the criteria for major depressive disorder are having the following symptoms within a 2-week period. And that would include feelings of sadness, emptiness, or worthlessness, a decreased interest in activities that you used to enjoy. And then there's a few other things as well, such as appetite disturbance. So that can be either increased or decreased appetite, weight loss or weight gain. And then we often see sleep disturbance as well. So people are either having problems sleeping or they're spending the majority of the day in bed sleeping. We also have people who experience lots of feelings of worthlessness or excessive guilt when there's really no reason to feel that way. Other individuals may experience cognitive difficulties, so that would include issues with attention or concentration or memory. And then finally, people will often experience suicidal ideation or thoughts about death that are uncharacteristic for them. So when you hear the term depression used, that's often what we're referring to. But then, as you mentioned, there are other categories of depressive disorders as well. So another one that we frequently see is what's called persistent depressive disorder, and that oftentimes is referred to as dysthymia. So persistent depressive disorder actually mimics the symptoms of major depression, but it's longer lasting. So it's a more chronic condition. And oftentimes people will describe that they've felt this way their whole life. The specific criteria is a 2-year period that people have experienced those symptoms. Then we can also have what's called double depression, and that's actually when the persistent depressive disorder and the major depressive episode overlap. And that can be a particularly risky intersection of symptoms where we often see that people are at heightened risk for suicide with the double depression. Some of the key causes can be genetics or biology. So we know that some people are prone to having disruptions in different neurotransmitters, and one of the common ones you'll hear about is serotonin. So therefore, some of the treatments that we use, such as medications, actually focus on serotonin and helping to balance that out. So genetics can be a cause. Situational or external factors can be a cause. So when people go through any kind of event that disrupts their lives, that could be a divorce, it could be the loss of a loved one. There's a period of time where certainly we expect that there's an adjustment to that, but if the symptoms persist after that time expires, then that's when we start to think maybe more along the lines of major depression. If you've ever heard of the phrase nature nurture, we use that a lot to talk about depression, that for many people there is a nature or biology component, and that's often compounded by situational factors or the nurture component as well. We could probably make a days-long list of misconceptions about depression, but I would say that some of the ones I think prevent people from getting the help that they need is that depression is maybe a sign of weakness, or that people should be able to help themselves out of a depression and that they shouldn't have to rely on a medication or on therapy to help them through that. And we know that that's just not the case. It's really difficult to dig yourself out of that hole on your own. So that's one misconception that we see. Another misconception is that once I have depression, I'm going to have it forever, or the symptoms are going to be present forever. And we know that especially major depressive disorder tends to wax and wane. So there's actually a term for that, which we call recurrent major depressive disorder, where people may go throughout, let's say, a 10-year period of life, and they will have some exacerbations where their symptoms are present, and then for months or years the symptoms disappear and they're able to function completely fine within their environment. There's mixed evidence on that topic, and one of the things that we actually see happening is that more people are coming forward to receive treatment, which is a good thing, but that can also lead to higher rates being reported, and that's particularly true if you look at gender differences. So it's in many ways, it's easier for women to come forward with symptoms of depression than men, but we do know that fortunately men are seeking help at higher levels than they used to in the past. So whereas we used to say that women tend to experience depression 2 times as much as men, we're finding that that discrepancy is starting to balance out a little bit more. In terms of increasing rates in general, we've had a lot of societal changes, not only this year, but just within kind of the past decades that have happened that also likely contribute to things like increased depression. I mentioned the social media before, and that's probably one of them too, that can potentially cause increases in depression. Yeah, a lot of times the treatment actually varies depending upon how severe the symptoms are. So for mild depression, many times people can do some therapy, do some supportive talking, and do what we call behavioral activation, which just means getting out there and doing things, getting some exercise, connecting with people. And that can actually oftentimes be enough to kind of push back the symptoms of mild depression. When we get into the more moderate to severe types of depression, that's when we're most likely going to usually consider a medication, and those can be very effective. They're more effective if paired with a well-researched therapy approach, such as cognitive behavioral therapy that I mentioned earlier. And so in those cases, we like to see a combination of the medications and the psychotherapy to help people. We have a very heavy seasonal component here. Our seasons are great and they're very enjoyable, but for a lot of people, that winter period, especially when it starts getting into February and March and it's really not relenting, can be really challenging. And so that's referred to as seasonal affective disorder. What can be very helpful for that is something called light box therapy. So you can actually go on Amazon and purchase a light box for a relatively reasonable amount of money, and you can keep that in your home or your office. It requires very little time during the day, about 15 minutes, and it shoots some UV rays your way in a safe way when we're not able to get that UV rays that we're able to right now with the beautiful weather that we're having. Yeah, I hear from a lot of patients about well-intentioned but unhelpful actions that family and friends take. So one of the things I like to tell people about is just to help someone feel heard. And in psychology, that's a term we call validation. So if someone comes to you and talks about their problems and talks about feeling depressed, you want to say, hey, I hear you. It sounds like you're having a really rough time right now. Inadvertently, what often happens is people will try to fix the problem, or they'll try to say, well, look on the bright side, look at all these great things that you have going on for you. And that backfires just because it minimizes how the person is feeling. And we know that with depression, it's not as simple as just focusing on the good things that we have going on or trying to fix a problem, because chances are the person has already tried to do that. One of the other things we talk about in psychology a lot is the difference between empathy and sympathy. So you want to try to do your best to display empathy to someone who's hurting. And we use a metaphor to describe this. So if you have a friend or family member who's kind of down in a pit and feeling pretty low, you can either stand at the top of the pit and wave down to them and say, hey, I'm sorry that you're down there. That kind of sucks. That's sympathy. Or you can actually climb down in the pit with them, put your arm around them, and sit beside them and say, I'm here with you as long as you need to be here. And that's more what we describe as empathy. So that's what we encourage when people are going through those hard times.